It's been an extraordinary 24 hours in the United States, with the president's COVID-19 diagnosis throwing an already chaotic election period into further disarray. Donald Trump has been relocated to a military hospital and he's being treated with an experimental drug. As the political fallout grows, so does the White House cluster, with the former advisor, Kellyanne Conway, the latest to confirm her infection. Ms Conway is the 7th person to have contracted COVID-19 after attending Amy Coney Barrett's Supreme Court nomination. In a post on social media, Ms Conway wrote she's now in quarantine and her symptoms are mild. It's feared more people who were there may now also be carriers. Let's bring in Professor Elizabeth Hartland, who is the Director and CEO of the Hudson Institute of Medical Research in Melbourne. Professor, thank you for joining us on the program. Now, Donald Trump is being treated with an experimental drug. How concerned should we be about that? That the leader of the free world is being treated with a drug that may or may not work, may or may not be dangerous?
Well, that's true. We don't know how effective this drug will be. The drug's been tested in about 275 people, and the average age in that clinical trial was 44, so that's quite different to Mr. Trump. And those people were able, or the investigators were able to show a lowered viral load and also a quicker time to recovery, but in any individual, it'll be really hard to predict what's going to happen.
Is it significant that the age group of the drugs that are being tested on is lower than Mr. Trump's age?
Well, it could be. Mr. Trump is in a very high-risk category, so because of his age and his weight, and also being a man, men are more likely to develop severe complications with COVID-19, so he's already in a high-risk group, and it may be that the trial group don't really match, these criteria, so it'll be a bit of an unknown as to how he'll respond to this therapy.
So how significant is the weighting of those risk factors that you describe, his age, his gender, and any underlying comorbidities as well?
Yeah, these are really significant. So we know from all the studies that have been done around the world and how people are affected by this virus that in people of older age, in people who have underlying heart disease or comorbidities, as you said, like diabetes, or they're overweight, and as I mentioned, male gender, they're much more likely to experience severe complications with the coronavirus.
So what we know for now is that the President is experiencing some mild symptoms, some mild fever. What is the risk period here? At what point may we start to see some more serious symptoms develop?
Well, generally around day 8 or 9, things can start to go downhill. That's when the immune response starts to really ramp up and people can begin to develop this life-threatening inflammation that leads to acute respiratory distress. So it depends a little bit how long Mr. Trump's been infected, and I'm sure his doctors will be very cautious over the next few days to keep an eye on that.
What more can you tell us about this particular experimental drug? Regeneron Pharmaceuticals produces it. It's being described as a cocktail of antibodies. How does it work?
Yeah, so what Regeneron have done is they've developed 2 very specific immunotherapies, antibodies, and these target the so-called spike protein of the virus. And so that's the part of the virus that it uses to attach to human cells, and once it's inside the human cells, then it starts to multiply. So the idea is that these antibodies can block this spike protein from attaching to the cells and thereby prevent the virus getting into our cells in the first place.
We also know he's being pumped with a few vitamins as well. What role will that have in boosting his immune system?
Well, again, I don't think that we can say, predict with any certainty at least, how that's going to play in, because we haven't done clinical trials on the effects of things like zinc and vitamin D and how that impacts people's response to the coronavirus. So really, he's in a very experimental situation.
All right, Professor, we'll leave the interview there. Thank you very much for joining us on the program.
My pleasure. Thanks for having me.